Nursing strategies to optimize health care for vulnerable populations. A focused look at how the surge in immigration is impacting the healthcare landscape. As members of the healthcare profession, it is important for us to be familiar with who our patients are. Their history plays an important part in our ability to quickly identify the problems they are facing and know the right strategies to treat those problems. To ensure we are able to do that, it is important for us to recognize the ever-changing trends in patient demographics. As our focus of study for this conference, we chose to take a deeper look at one quickly emerging demographic in particular. Today, immigration accounts for roughly half of yearly population growth in the United States, and immigrants make up for nearly 15% of U.S. population, with statistics showing an influx of over 45 million foreign nationals entering the U.S. in 2021. Those numbers are only set to continue going up. Among the projected 441 million Americans in 2065, 78 million will be immigrants and 81 million will be people born in the U.S. to immigrant parents. With numbers like that, it is all the more apparent why it is important for us to begin to consider now what we can do to better prepare for the changes we will see in the healthcare setting as a result. If there is anything we should have learned over the last 3 years, it is that illnesses can spread far more quickly in today's age of global travel than at any other point in history. Population migration plays a critical role in the spread by initiating outbreaks of acute diseases, changing the prevalence of infectious diseases at any given location, and changing the face of chronic disease resulting from previous infection. Travel and trade are also associated with the reemergence of illnesses like plague, smallpox, measles, syphilis, and more recently, HIV and TB. Vaccine-preventable diseases, including measles, mumps, rubella, polio, hepatitis A, and typhoid fever, are on the rise in areas where preventative measures had previously made them rare conditions. Healthcare professionals have become less familiar with the typical clinical manifestations of some of these infections, leading to potential delays in diagnoses.
In response to the ever-increasing diversity in demographics, those in the nursing profession must maintain a high degree of suspicion when evaluating patient symptoms, keeping in mind diseases that may have become less common in the United States. It is often the case that immigrants may have not received vaccines routinely given here or could be suffering from conditions as a result of prolonged malnutrition or parasitic infections. Arriving at the correct diagnosis often requires detailed information from the patient about their migration history, access to specialized laboratories that can assist in making a diagnosis, and for some diseases, access to specialized medications with limited availability. The period of latency between being infected with viruses such as hepatitis B, HPV, or hepatitis C and development of malignancy may be decades, meaning that for many arriving in North America now, although they may be carriers of these infections, their symptoms will not begin to manifest for many years to come. Another concern for the immigrant population as they enter the workforce is exposure to risk for infectious diseases for which they have no built-up immunities. Still, more challenges can arise for the healthcare professional when seeking to provide for a high index of foreign-born clientele. These include overcoming language and cultural barriers to care, addressing differentiating beliefs about HIV/AIDS, providing care in the context of competing priorities such as housing, jobs, and family stress, and addressing the psychiatric needs of immigrants living with HIV. Once a diagnosis is made, additional challenges include addressing the stigma associated with diseases, the long period of treatment required for dealing with many of these chronic conditions, and the risk associated with late-stage diagnosis as a result of immigrants often delaying in seeking medical attention until the illness manifestations have become pronounced.
With all of these challenges increasing the workload on an already strained healthcare system, what are some small steps we can begin to implement now so that we do not reach a point of crisis in the future? First, we can prioritize safety standards along every step of the healthcare setting. With the rise in illnesses that were previously on the decline, it is paramount that our care staff remain safe and free of contamination. Second, we can increase the number of translators and social workers within the healthcare setting. The immigrant population is the most vulnerable group in the hospital. Providing them with resources to ensure they receive the best possible quality of care is the responsibility of everyone on the healthcare team. Lack of health insurance is a huge problem among the immigrant population. Even for those who may qualify for help, knowing how to apply for that assistance is often an insurmountable barrier. Increasing the number of full-time staff who can provide step-by-step assistance for these families is another way of smoothing the care process for them. Lastly, we can take an in-depth look at what areas of the hospital are likely to see the highest increases in demand, what precautions staff should be taking, and what medications we can keep on hand to deal with those rising demands. As we emphasized before, the data shows a steep increase in many illnesses that were previously under control here in North America. Hepatitis A and typhoid fever, to name a few. To combat these rising numbers, we can educate staff on early identification of these illnesses and provide easy access to the drugs needed to treat them. We need to prioritize early implementation of isolation and precautions for patients suspected of carrying any of these communicable diseases, and provide the safety equipment our staff will need while they provide treatment.
To conclude, the number of immigrants into the United States is steeply on the rise, with data projections showing those numbers are only set to increase. The effects of this surge in immigration will be felt across all aspects of the healthcare landscape, and is something we should begin preparing for now. To prepare, we should learn the early signs and symptoms of illnesses that up until now were not as widely seen in our healthcare fields. Early recognition is key. We should increase the number of personnel trained to assist in immigrant patient cases, provide safety precautions for all personnel and patients, and begin to increase the number of medications we keep on hand for the diseases we see quickly emerging.